Hi guys, how are you? I wanted to give everybody an update and just kind of an idea of what everything has been going on in the company and how we're handling it and rationales for things. There's going to be way too much to try to put another written Paylocity announcement, so I wanted to make sure that you guys get a chance to just really know that we have been really behind the scenes working on everything going on and that we do have things planned for how we would like this year to go. I guess the first things I want to talk about, we're going to kind of go way back to when things started, so let's talk about mask wearing. Just recently, we've been getting some more information that will look to allow us to move to a mask optional status within the companies. Back on February 16th, the Mission Department of Health and Human Services was kind of lifting the need to use masks indoors, but still suggested that healthcare facilities continue wearing masks. Now, yes, we're a healthcare facility, but I think a lot of it where they were dictating is if you are a healthcare facility where sick people or people with a chance of having the virus are going to come to you directly. We know people could come to us carrying the virus, but most people do not come who are ill and carry the virus. Then on February 25th, just last week, I know some of you probably already know this, that the CDC themselves has lifted the mandate. Again, leaving it to entities to decide what was best for them. We're kind of waiting to see if, since the CDC just came out last week, is Michigan going to update theirs a little bit more? Either way, looking at things, we feel like we are in a position that if things continue to progress like they have in the positive direction, we are going to be able to go ahead and start making masks as an optional for both for patients and employees. Couple things with that. I think the first thing we need to do is we're going to post it before we do it so that patients who are a little unsure, insecure with that idea can either kind of ask questions, cope with it. We can talk to them about masking and going in to booths and being by themselves if they want to. They could decide just to finish up their treatment within that time provided. We think the majority of patients and the majority of staff will so look forward to getting rid of masks, and there's going to be a minority of both, most likely, that want to continue wearing them. You have the choice when we get to that point, and everybody should be okay with whatever choice somebody else makes. Okay, so I'm still going to wear a mask. I'm going to wear it as little as possible, I'll be honest. But I will wear it if I'm doing cervical mobs or if I'm right in someone's face. I think, and I'm going to wear it if I'm not doing anything really super close, but the patient wants me to. Okay, so we can't become one of those places that says you don't have to wear a mask in here, so I'm not going to, even though you want me to. I mean, we have to be respectful and understand if we have a patient that prefers us wear a mask while we're working with them, we do that. The other thing is, obviously, you should continue wearing them if you think you've been near an exposure. If you're not feeling very well, obviously, if you're symptomatic, you shouldn't be coming anyway or should be getting tested. But hopefully, this is going to get to the point where people can slowly open up, feel more comfortable, make decisions for themselves, feel respected, even though there'll be a percentage of people who feel like we're not respecting them because we're opening them up to this. But it's going to be over 2 years of wearing masks, and with numbers going down and CDC recommendations, it's time to start opening things back up. So again, be respectful of each other and patients when we get to that point. We haven't solidified, but we're talking about posting soon in the next couple weeks so that come the month of April, masks are off for those who feel comfortable with masks off, okay? Just be careful how your reaction when you actually see what some of your patients look like and you're like, oh, I didn't expect that. Because they might do that to you too, actually. So just be ready for that. Next subject, expansion. So some of you, the question is, why are we expanding if we're short-staffed or in this environment, or if we're, our revenue is not generating the way it should be and will be. But this Red Cedar expansion that we're doing up in the Frandor area of Lansing, that was first talked to us, it was about a year and a half ago, the first time we ever heard anything about this. We did not seek the opportunity. We're obviously not looking necessarily to expand based on the expansions we had done in 2020. But this opportunity came to us. It wasn't one that could just wait until things settled down because someone else was going to go in there. It was people who respect us as a company felt we would have a great presence. It's going to be right in with student housing, a retirement facility, a new hotel, other apartments, other retail services right in Frandor, bustling area, right off of 127 Michigan Avenue. It was a great opportunity, and we felt we had one other person ready to take on that responsibility in Paige Ellsworth. So, as the most recent expansions have been, opportunity matched with a person wanting an opportunity and wanting growth, and we had that. And again, we felt that in the time frame it was going to take, things would work out really, really well. Obviously did not expect things to uptick again in second and third waves. We didn't expect a lot of things that have kind of made things a little more difficult. It's a couple staff changes we obviously didn't anticipate last year that made us a little bit short on PTs. So this is going to be a really, really good thing. Right in the heart of that area, expand our Lansing connection, which has been really growing very, very well. It's actually kind of fun sometimes to be up there and people think we're a new company. So we are not looking right now. There's no other plans for an expansion to a brand new clinic, yet we have ideas. We have some staff that we would like to be able to get into other areas. We won't be making those moves until we really feel ready to. This was an opportunity, again, presented a long time ago to us that we couldn't pass up. So that's why we're expanding, even though we're in this situation. It just, with everything going on, supply chain stuff, all that, it's been pushing it longer and longer into this area, which has actually been a good thing for us as far as just timing of everything. Another part of the expansion, our central office. So we're moving out of Page Avenue, and we're going to be taking on this new space at Dr. Rosenberg's on West Avenue. This was not a choice, okay? It's going to be a great clinic. We're looking at the design. It's a 6,000 plus square foot clinic that's just going to be open, and more of the design of most of our clinics, where Page Avenue has been fantastic. It's 5,000 square feet of gym over here and booths over here, and it's the flow sometimes a little bit harder, and it's showing a little bit its age. So it's going to be a good move. But we had no choice but to make this move because Dr. Rosenberg wanted rehab in that space. And actually, the first time he ever mentioned anything was probably about 2 years ago to me, and talked about what he was thinking of doing. Or you wouldn't want another. You don't need another PT clinic in Jackson, do you? You wouldn't. Why would you want to? And I had to convince him. No, we'd be very interested, and we could do this. We could even move the aquatic center there. There's a lot of different things that we could do to make it a centerpiece. And no way was I want him to connect with Athletico or ATI or somebody else to put PT in there, okay? Dr. Rosenberg, Arntz, and Channing Smith, that office are our number one referral sources for orthopedic rehab specialists. If we had not gone into that space, somebody else would have, and we would have lost a very large chunk of our patient load, visits, community connection, and obviously revenue. So that was going to have to happen. We're going to have to move out of here. That was the logical choice. We couldn't just add another clinic in Jackson. So then now that creates 2 new clinics going up in 2021, a relocation and an expansion. But those were just kind of almost no-brainers for us to feel like we had to make these decisions to take advantage of opportunities and also keep our connection with our number one referral source. Okay, so then I just brought up, the fact that I'd even offered to Dr. Rosenberg that we could make any clinic he put in there, we could make it a a specialty thing. We can highlight Central Jackson with our pool. Well, obviously that's not going to happen. Some of you are wondering exactly why we're closing the pool, or why, I guess, as of next week, we have closed the pool. And several things go into it. It does count the underutilization of it. It also obviously is a bit of an expense. Also, staff shortages. We need staff elsewhere while we're still having trouble really expanding our resources and PTs. And then, the thought of, well, let me say this, and I mentioned this with some of you already, but we were the first ones to ever have aquatic therapy in Jackson, and that came about as a request, like, can we have something in Jackson, because everyone's going to Ann Arbor or Lansing. Then the hospital, and then Gantons. Gantons actually came to our pool and looked at it and put one in. Okay, since that time, we opened in 2007, so we have had the pool for 15 years. The hospital closed theirs, Gantons has closed theirs, and so now we're the last ones with one open. I said, to me, that's telling that 3 different entities tried to do aquatic therapy, and it didn't work out in this community. Possibly if we had set it up differently, a different structure, who knows? But with everything combined, the staff needs, the expense and everything, we just felt we had to move on, and that also is going to work on like another next step, which is what we're going to do with that building. Options are that we can utilize that building for. I want to give you guys information without like too much speculation or too much detail that you don't really need. But an option is for Connie to go and take the total joint center to the new space. It's big enough, and then we could create a niche for her there, have a little bit more support too, have a little bit more support for coverage, and then that space could be either used by us, or we could sell that clinic and have that expense gone. Okay, so there's just a lot of things that have gone into pool closure and next steps. All right, then we come back to here. I'm sitting here in the small conference room, hanging out with Mark in Page Avenue. So with the clinic being moved, if Connie were to go with everyone at the new space, do we hang on to Page Avenue? What do we put upstairs? We have a lot of the corporate stuff down here. What are options? Well, right now we could be looking in October of having 4 buildings that we're paying leases on and only occupying 2 or half occupying 1. So we're looking at all the different options we could be doing to control expenses, because obviously bigger space, nicer space, a little more expensive. The Frandor is a little more expensive. And then we have the 10,000 square foot facility that we've been in for 23 years now, or almost 23 years. And then Total Joint Center. So there's a lot of buildings. We have to be good stewards moving forward of our expenses. So there's options for Page Avenue. There was some discussion of we bring Total Joint here to the upstairs and sell that building. Don't know if that's really an option with all the different remodeling we'd have to do. So we are looking at the possibility of selling the Page Avenue clinic, moving our corporate offices, and also utilizing space that's not being utilized in orthopedic rehab right now. Again, we have these great opportunities. We need to control our expenses, and we have multiple offices, massage rooms, conference rooms throughout orthopedic rehab that's very rarely being used. So why try to maintain a larger space when we have space available? Okay, so we are looking to relocate, have our patient accounts and call center in a specific location, but then utilize the offices for Mark and Kim and Amy and that Bree, Becca, everyone that needs an office, Angie, but utilize space that we're already paying for. So yeah, I mean, there's a lot still going on, a lot to be figured out, but we are talking about this constantly. We're looking at our options constantly. We've looked at We've gone with realtors looking at space, both for lease and to purchase. We are talking to other entities to potentially look to purchase one of the buildings, Total Joint Center and Page. So there's a lot going on, but we meet about this weekly, and we're talking to other community members that we need to. Ultimately, it's just a matter of coming out of this year with 2 beautiful new clinics to go along with the wonderful ones we already have, but then also decreasing our expenses and offsetting things so that we can continue moving forward. So, I just had a meeting earlier today, a facility manager meeting, and, Barb brought up that she had talked to some staff members, and, is there a concern that all these changes and closing this and moving this and getting out of Page Avenue are going to change, who we are or our culture? And one of the first things I brought up was, the culture our patients feel and the environment they feel and everything, it's within the 4 walls of wherever we are. Okay, I've talked to you guys, and I mean this, whenever I go someplace and a patient sees me and wonders who the heck I am, who's a strange guy people are talking to, and they find out I'm one of the owners, they want to tell me, you got to know how wonderful your staff is. That's every clinic. So it doesn't matter what building it is, it's the environment. And I can tell you my really, really fond memories. And me, every once in a while I get emotional. And so when I think about stuff like this can happen. But when I think about the beginning, my first career here in being down there at Total Joint Center, which was the blue building, I have incredibly fond memories. And yeah, I can picture the building, but what I picture is hanging out and working along Richard and Jerry and Karen and Becky and Lisa, those PTs plus everybody else. Those memories are the people, okay? So a lot of you are going, what are we gonna do without Page Avenue? Well, first 15, 16 years of our company, well, I apologize. First 12 years of our company, there was no Page Avenue. It was just Total Joint Center, right? And some of us moved here, thought it might be different. Well, all of you guys that have worked here in Page Avenue, it's like, what are we gonna do without Page Avenue? I mean, that's our thing. Well, I have fond memories of Page Avenue. I have fond memories of, again, Jerry, and I've Richard's last year with our company or less. My student named Aaron, our new PT named Brandon. I mean, Page brings a lot of good memories. A couple therapists named Dave, which are different memories. But anyway, it's really about the people and the environment we create. It's not about the building, okay? I mean, people say, is it going to change things because we don't have a pool anymore? Well, the first 15 years of our company, or 20 years, of our company, there was no pool, right? And then 15 there was, and maybe for a while there won't be again. So it's up to us to create the environment. And the feel. And I think the most limiting thing to our normal culture and environment has just been the nature of this world lately, and not being able to connect, not be able to get together, and not being able to see each other's faces consistently. It's not the buildings. So I think, whatever new employee, think again about the people who never ever worked. 95% of you who never worked in the blue building, and the great percentage of you that never worked here at Page. 4 years from now, when we get a new employee and they love it, they're not even going to remember or know anything about the other 2 buildings, but they're going to create their memories in the next building. So it's up to us, and we are going to do everything we can. Part of being us that we have not been is just being able, again, to get together, right? And then also, we need to do a better job, again, of moving the company in the right direction and acknowledging the changes that we have. Richard and Jerry started one clinic operation that they were going to have fun doing it their way, and that's what attracted me to this business, was how they set it up. I've wanted to continue that. Brandon and Aaron and I all want to have that same thing. Everyone that's going to be moving forward with us want to continue that, right? But we've had to make changes in the company to continue to, stay connected and still have growth and stability. Some of you have been concerned that as we expand more, are we going to lose that connection? Well, again, we've got much bigger, and I really do feel if it wasn't for our limitations from the pandemic, we still have that environment again wherever you go. But also we have to do a better job of operating the way orthopedic rehab clinic does. I mean, I know some of us are just kind of like tired of the atmosphere and tired of being tired and people having to cover for people because they were off. Well, that's happening less and less, except for vacations and babies and stuff that are going to always happen in orthopedic rehab. We have a very fertile group in orthopedic rehab. But I want to be able to create a steady flow of patients. It's a better environment when it's busy. It's buzzing. I mean, literally, literally is not a good word. So it's nothing really buzzes, but it seems like it buzzes when you're working in the clinic, and it's just fun. Okay. In that steady growth, steady flow, steady revenue, we want to get back to our quarterly bonuses, our baseball tickets, hockey games, annual meetings, winter parties, and that's right here for us. It really is. And even with the expansion, even with our shortages, right now we have the staff and everything to create the visits, the flow, and everything that we need. I think all the therapists that we're hoping to get in the next few months will make even that much more of a difference. So we understand that's why we've done the orientations. That's why we started working with the core values, is because we understand as we grow it's going to be harder. So we want to continue making those connections. So as we talk about adding more therapists, I just want you guys to know we've done pretty much everything we know that we can do. We're getting involved and talking directly with the clinical educators at PT schools. We've been in special programs with Indeed, ZipRecruiter. I had a Zoom with one of our former aides who's in PT school last week. When I'm done with this, I have a Zoom with another potential student, but one of the big things we're doing is the student conclave, and I know a lot of you know about it, but this student conclave, this is for third year PT students. The last time they actually could do this live, we hired Paige. We hired another therapist named Craig who worked for us till he moved out of town. And we had a little booth there, did some mock interviews, and made these connections. This time, we realized this was a great opportunity, and so we're the title sponsor. We're going to have the main table in there. We have Aaron and Becca and Amy are going to do mock interviews with students all day Friday. I get to do a presentation, the same presentation twice to all the students about what to look for in a job, make sure they understand that they should be looking for environment and continuing education and all the different things that really make working at a place special other than just, going in, seeing a patient, getting a paycheck. There's a pub crawl April 1st. I'm not sure exactly where they're going, but there's a lot of good places in Kalamazoo. We're going to try to connect with them socially, be there all day Saturday. So we have put a lot into this, what we're going to be giving away, how we're going to be able to try to connect with these students. And so our hope is, if we were able to pick up 2 a few years ago, and one incredible one that's becoming a manager for us, then we should be able to pick up 4 or 5 based on our involvement this time. And that'll make a huge difference too, because we have, more babies coming and we need more help and coverage besides summer vacations. So we're putting a lot into that. Anyone's welcome. You don't have to. It's in Kalamazoo. I don't even know the structure of it, but a bunch of us are going to just hang out and try to drop in a couple different places. Kalamazoo, Friday night, April 1st. Just be available to talk to students socially and that. So as I've talked about, I'm not going to follow these kids in the bars and stalk them, but I'm going to be available to them at different places. So that's a big one. We put a lot of time into that. We still keep going through the traditional routes too. Ultimately, down the road, I think we need to get even more involved into students and at the school level. Internships, even if it's first or second year students and not third year, get them early, get them an atmosphere early they can compare to other places. But I just want to let you know that we are doing everything we can to kind of help get more support. I think we've done a really good job of setting the infrastructure at orthopedic rehab over the last 2 years, support, enough office staff, people that can help with communication, like our patient care supervisors. We're ready to really take that next step. So we're going to look at trying to control the expenses. We're going to take advantage of these opportunities, and we're going to just build from here. I think there's a lot of good things happening. So, I'm trying to give you some information on what we're doing and the rationale behind what we're doing. I'm not presuming by any means that I've solved all the problems or answered all your questions, but please reach out if there's things that you would have liked to hear more information about, or things you have questions on. Reach out and let me know. I can tell you that the staff we currently have, the situation we currently have, we're fine if we just continue being who we've always been, get our numbers back up to where they were before January 1st, before the system shut down, before snowstorms. I'm anticipating one more snowstorm, at least, beforehand. But, help us help you. Is that a famous line from something? Help us. If you're in a position to collect a patient's payment, just ask them how they'd like to pay. Don't ask them if they want to. And if the patient asks, hey, can I make a payment today? Please don't tell them, oh, you can do that next week, okay? If you're in the position to bill for what you do, please bill for what you do, okay? We have a very valuable special service that gets discount reimbursement. And if you guys discount the discount, or you don't put value, the patient's not gonna put the value on it. And we have therapists that have worked here and gone other places. We have therapists that have worked other places and come here. And if you're looking for an outpatient orthopedic setting to work, you're not going to find one with a better environment, better benefits, everything that goes with it. And I want to continue that going. So as a team, we need to keep doing